this is Dr. Lahari from Dental. A very frequently asked and the most repetitive question I get from everybody I meet as a dentist is like, how frequently should I clean my teeth? I brush my teeth twice daily, but still I know teeth cleaning, or how does teeth cleaning improve my dental health? These are the multiple forms of the question I receive very frequently. Teeth cleaning is professionally called scaling in the dental literature. Scaling of the teeth is very important to maintain the gum health more than the tooth health. So scaling is an exclusive periodontal or the gingival or the gum phenomenon. Many people think scaling is for the teeth, but scaling is chiefly concerned with your gums. How often I should clean my teeth? As a rule of 7, every year make it a point that your birthday marks the date of your cleaning. Every year before your birthday, try to clean your teeth. That way you never miss it. That way you don't forget it. But with people having the following cardinal signs of gum inflammation like gum swelling, gum bleeding, gum softness and gum inconsistency or the change in the shape of the gum. People with all these features, they may need cleaning or scaling more frequently than the others do. What are the signs that are the warning bells from your body to indicate that your teeth need to be cleaned or bleeding while brushing? We call it the pink toothpaste. That is when you spit out, you see traces of blood in your spit. That is one primary indication where your gums are getting swollen. And bleeding from the gums, change in the shape and texture of the gums, and visible deposits on the teeth. Between your teeth and your gums, some deposits, some debris, some calculi will be visible. That is a clear indication that you need scaling or professional teeth cleaning from the doctor. I warn you and advise you not to try any indigenous or home products to clean or scale your teeth like salt, charcoal, baking soda, which will eventually damage your gum health. Professional cleaning does not lose your teeth. So many people have a myth which needs to be busted that with cleaning, teeth will get loose. It's an absolute misconception. Teeth cleaning or scaling actually makes your gums stronger. What if my problem is not corrected with scaling? That is the next question. If your bleeding, if your inconsistency and the loss of the texture is not even corrected after repeated scaling, your periodontal condition will be analyzed by me through a radiograph and through soft tissue analysis, and then advanced periodontal therapy like curettage, gingival cleaning or flap surgery, and if in the cases are needed, laser periodontal therapy will be needed. Most of the times, at the primary indications of the gum problem, a small scaling, a minimal cleaning of a teeth professionally would prevent n number of dental diseases, n number of dental problems. So make it a point to include teeth cleaning or scaling in your yearly schedule. Try to get your teeth scaled at least once in a year, and you are a person with diabetes or renal problem, or if you are in the phase of your pregnancy, try to see your dentist every quarterly, that is every 3 months, and try to get a scaling done. Scaling nowadays is absolutely painless and a very traumatic procedure. Don't hesitate yourself from getting a scaling done. Have a very proper scaling, very frequent scaling, and maintain your proper gum health for a strong and healthy teeth. Hope this video answered your questions. Thank you.